Sunrise Community Health is a federally qualified health center, also known as CHCs. Our mission, affordable access, quality care for all.
The biggest impact we have is that people know that they can receive quality care in a compassionate healthcare home. And that's what I hope people know about Sunrise. I wish they knew the breadth of services. I wish they knew the dedicated team. And I wish they knew the cost savings that can be found at Sunrise, not just for the individual, but for the whole healthcare system.
I get so excited when I walk into an orientation room and I see new team members, and so many are either telling us that they were patients of Sunrise or their parents were patients of Sunrise, or they just have a heart for the mission of Sunrise.
If you look at where Sunrise is going in its journey, it continues to build on partnerships. Banner Health, North Range Behavioral Health, we have oral health. Is made possible because we have very strong partnerships, and that's going to continue for us.
We have 13 clinics located in Evans, Greeley, Windsor, and Loveland. We offer comprehensive, affordable medical, dental, vision, and behavioral health services. We believe that healthy people create healthy communities, and all of us should be able to have access to the right care at the right time for the right cost.
My name is Dr. Brenda Campos Spitzy. I am faculty here at the Sunrise Community Health Center. Also a former resident, so graduated in 2017 and decided to stay on as faculty. A little bit about me. I'm from California originally, born and raised. That's where I did undergrad and medical school. Had a short stint on the East Coast where I got my public health degree. My last year of medical school, as I was looking for a perfect residency program to become a full spectrum family doctor, I really wanted to work at a community health center, to be trained at a community health center. I knew I would eventually wind up working in community health, so that made sense for me. I was looking to work in a community with a lot of Spanish speakers. Soy hija de inmigrantes. I'm a child of immigrants, and I have always wanted to dedicate my career and my life to serving the immigrant community, specifically monolingual Spanish speakers. So that was really important to me and my spouse. I should mention that couples matched into the Sunrise residency program. And we researched programs across the country, from California to Oregon, Washington, North Carolina, all over the place, and Colorado. And so of the programs we researched in Colorado in family medicine that trained in full spectrum, meaning cradle to grave, womb to tomb. My husband specifically was very interested in cesarean deliveries and being able to provide that level of obstetric care. This program for us really stood out as checking all our marks as far as a large immigrant community, full spectrum family medicine, including high risk obstetrics with cesarean deliveries. We didn't realize we were going to stay here. We thought we would go back to California, which is where we're both from. And after 3 years of training here, just fell in love with this. So what makes Sunrise unique is you are getting your outpatient training in a federally qualified health center. They're also called community health centers. So that is pretty unique. There's not a lot of programs across the country that allow for that type of outpatient training. And so we are not a residency clinic. We are residents, or our residents are residents within a large community health center. So that experience is very unique. Greeley, Colorado is unique in that we're the second largest refugee resettlement area outside of the Denver metro area in the state of Colorado. So we have a lot of diversity at our community health center. So in a half day, I will be mostly speaking Spanish during my half day, but at least 2 or 3 of my patients that are sprinkled into my schedule come from other parts of the world. So the training you get here, you get to stretch your limits as a family doctor because a lot of our patients are either uninsured or they're underinsured. And so while there may be a specialist, within 2 miles of where our patients live, they often are cost prohibitive and our patients don't have access to them. So aside from being a family doctor, I pride myself in being a cardiologist, a nephrologist, a hepatologist. And so I really really try to save my patients money by stretching my skills as far as I can, and providing the highest level of care at the lowest cost. But year after year, the residents that we attract are just rock stars who want to meet that level of challenge and provide high quality care for our patients. So something at Sunrise, I think when people are looking for family medicine programs, you want to make sure you're getting a healthy balance of pediatrics, obstetrics, chronic illness, adult medicine. Like I said, we pride ourselves in being cradle to grave or womb to tomb. And something special about Sunrise is we have such a great mix of all those different population groups. Specifically because we do so much OB, so much prenatal care, those mamas will bring those babies right back to us. And so we have this really healthy mix of newborn visits and well child visits and well adolescent visits, along with your type 2 diabetics and chronic hypertensives and cirrhosis and COPD. And so it gives you this variety of medicine in just one half day. I also always say that we attract 3 different types of residents in our clinic. One is a resident who plans to live in Peru and serve in a remote, village. So a doctor who's planning on international medicine needs as many tools in their belt as they can possibly have, because literally there are no specialists and they are often the only provider in these remote areas. So we attract people interested in international medicine. We attract people interested in rural health because in Wyoming, there is not a lot of specialists there either. And then the third group of people we attract are people like myself who know that they want to work in community medicine at an FQHC, at a community health center. And so why not train at a community health center if you're going to work at a community health center? If you plan to be a community doctor, this program will equip you. I always say you come out of this program bulletproof. You are a perinatologist. You are, like I said, every specialty you can think of. And you feel confident in your skills that you are not giving subpar care to your patients, but if anything, elevated care. What made me stay is Greeley, Colorado. This place is so unique. Coming from Southern California, Latina from Southern California, I had no idea there were Latinos outside of California, really. And so this pocket of Northern Colorado that is so diverse, like I said, in our schools, 40% of kids come from Spanish-speaking homes. I had no idea. And so I wanted to be here in this blue-collar town that is traditionally very conservative and agriculturally based, that is having this demographic shift. And to me, it was like an exciting thing to be a part of forming this community's reaction to the demographic shift with incoming immigrants, incoming refugees. Because of the work offered at the meatpacking factory, I just saw so much potential for contributions I could give in this type of community. I also love that there's a 4-year university in town. I love working with students. Even as a resident, I loved working with pre-meds at UNC at the University of Northern Colorado, and saw a lot of excitement around that. If you don't already know, there's going to be a College of Osteopathic Medicine opening in Greeley in 2026, and it's only the 3rd medical school in the whole state. And one of the focuses of the College of Osteopathic Medicine is to have a diverse medical student body that is culturally representative of this area. So I'm excited to be a part of that. And I guess that didn't exist back then, but I could see the changes happening in Northern Colorado and just wanted to be a part of that. Yes. So as many residents, when you're applying for programs, you are thinking of where am I going to enjoy living, Living in Northern Colorado is awesome. Like I said, Southern California, I did not ski growing up, but I quickly learned to ski in order to have a life in the winter here. And so the snow is amazing. I did not grow up with 4 seasons, and my husband did. He's from Northern California, so there is snow up there. but I have fallen in love with having 4 seasons in Northern Colorado. Greeley specifically is very family friendly, and I know many residents, they either have children already in residency or they're going to have families soon. We actually have a tax in Greeley for parks, and so we have over 30 parks in our city, which is pretty cool. We're really excited that they're about to open a climbing gym really close to here. But like I said, I looked at all the programs in Colorado because I was interested in living in Colorado potentially, and Sunrise is the only one that stood out, and it stood out a lot. I actually interviewed at Sunrise in January of the interview cycle, which is the very last month before, and so I had already interviewed everywhere else, and Sunrise was one of, if it might have even been the last program we came to, the only program in Colorado. And I just remember, like I said, I couples matched with my husband after we were done with the interview. We were like, this is the place. This is where we're coming to train if they'll have us. To be honest, in the 10 years I've been here in Greeley now, I didn't know how much I was going to love working with a refugee community as well. The immigrant community, that my parents are both immigrants from Central America, so that's just a personal passion of mine. But in these 10 years, seeing the waves of immigrants or refugees, rather, coming from Somalia, Malaysia, now there are Chuukese-speaking people from Micronesia, and our Oromo speakers, and just people from all over the world who came here to seek refuge, right? Like refugees, to seek shelter, and to have the privilege and the honor to get to be their doctor and their kids' doctor and take care of their pregnancies. And it's after a lifetime of trauma that a lot of our patients have gone through, is so cool. And I have really loved that part of my job as well.
If I had to summarize Sunrise's Educational Health Center in one, it would be an organization that is built on when one person teaches, 2 people learn. And what we mean by that is the teacher itself is learning and the student is learning. And so that is kind of what our Educational Health Center motto is built on. It's also our responsibility to teach those who are coming after us. All of us have either had a mentor or a preceptor or training that taught us the things we know. And so it is our job to train those that come behind us. One day, the individuals we train are going to be the individuals that are taking care of us. The doctors we train are going to be the doctors that are taking care of our kids and taking care of us. And that's true for every sector. So if I had to sum up what stands out about coming to Sunrise and learning, not just our mission, but it's part of the heartbeat of Sunrise Inc. Teaching is just what we do at Sunrise. Across all spectrums, we are training individuals from medical assistants to doctors, to nurses, to administrative students, to the next CEO. Sunrise leans in that space to train the next ones. When you come to Sunrise, you're not just joining an organization. You're joining an organization that is going to equip you with the tools you need to serve the communities that we are serving. They're going to provide you the tools to help break down some of those barriers that our patients are trying to overcome.
I'm Sammy Driscoll. I'm a second-year family medicine resident here at Sunrise. As a resident, I work very closely with North Colorado Medical Center for all my inpatient training. And so a day in the life is very variable depending on which rotation you're on. But usually if I'm inpatient, I'll go spend the morning in the hospital, either delivering babies or taking care of sick people in the hospital. And then I'll come over to Sunrise in the afternoon for my continuity clinic. And so I get to build my own panel of patients that I see regularly at the Sunrise Clinic. And then in times when I'm outpatient, I'll spend the full day at Sunrise seeing patients all day there. When I was looking for a residency program, I was really looking for something that was going to be full spectrum in terms of family medicine, somewhere that I could learn high-risk obstetrics, I could learn inpatient medicine, but also be involved in the community as an outpatient doctor. And I was also looking for a community health center because I knew that I wanted to work with high-risk patients who are underserved, and and so Sunrise was really the best combination of both of those things. I trained previously in San Antonio, Texas with a highly diverse patient population, and so I was looking to find that in a residency program. And here in Greeley, Colorado, little did I know, there's a really highly diverse patient population that I get to serve as a resident. And it teaches me so much about not only the medicine of treating these patients who often are a little bit higher risk and higher acuity, but also about having culturally competent care and learning so much about different cultures. Every day looks different in residency, especially here because we focus so much on full spectrum family medicine. But I think in the mornings, usually we're on inpatient rotations. And so in the mornings, usually at the hospital, delivering babies, seeing sick patients, taking care of pediatrics there. We do a lot of really great work. And then in the afternoons, 2 times a week about when we're in service, we come over to Sunrise and get to do our continuity clinic. And for me, that's kind of a breath of fresh air. One, it's the variety, right, of the inpatient versus outpatient, but it's also the environment at Sunrise. We have incredible preceptors and faculty there that we get to learn from every day. And the whole staff is really dedicated to serving our patients. And so it really feels great to kind of have that split. I think what's so special about a community health center in terms of learning medicine are kind of 2 things. The first thing is that we see a variety of patients in terms of pathology. We have a large immigrant and refugee population, and so we see a lot of things that are not as common in the general population. And so we learn how to treat those things. We also have a little bit broader scope of care because these patients have limited access to specialty care. And so we learn really how to manage highly complex patients, how to do procedures like OB ultrasound, which is sometimes a rarity for family medicine, but that's what our patients need. And so that's what we learn how to do here. And then the other piece is really learning that culturally competent care. I think it is incredible that I will see patients. About a third of my patients will speak English in a day, about a third Spanish, and a third all other languages. And so I've learned so much about other patients' cultures and how that affects their healthcare and how to provide culturally competent care here at Sunrise. And so that's what makes being in a community health center where everyone's focus is doing those things well, really special. I have one patient who comes to mind when I think about what it means to be a continuity provider at Sunrise. I had a patient who was a recent Haitian immigrant. She came to us about 16 weeks pregnant, and she had recently immigrated from Haiti. She was by herself. Her husband was in a different state waiting to get transferred here to Greeley. And so I assumed her pregnancy care. And in talking about her prior pregnancies, she told me that her first baby had actually passed away tragically in Haiti, only a few days after being born. And she was alone for that time. And so in her sharing her story, I felt very bonded to this patient. And I really dedicated the time to make sure that she got the care she needed. And then towards the end of her pregnancy, her husband had made it to Greeley. And so he started coming to her appointments and I got to meet him. And it was just really fun to see them prepare for their baby together. And then I got to deliver the baby in the hospital. And now the baby's on the schedule to come back and see me probably in a couple of weeks. And so that to me really shows that we get to take care of these patients and we get to learn their story and then we get to continue to follow them and their babies through their lifetime. And it's such a special experience here at Sunrise. I think training here at North Colorado and North Colorado Family Medicine, something that is so unique is the full spectrum training that we get. Like I said, we do a ton of high-risk obstetrics. We train in C-sections if that's something that you're interested in. We do inpatient adults, inpatient pediatrics, and have really robust training at the hospital level. And I think that that's something that's unique to family medicine residencies and really important if you plan to serve an underserved community, whether that's rural or a community health center. One thing that I think is really unique about our training at Sunrise is the amount of outpatient procedures that we get to do in the clinic. Our preceptors are extremely skilled, and so they help us with IUDs, Nexplanons, all of those birth control type procedures. We have several preceptors who do vasectomies, so you can be fully trained to do vasectomies if you'd like. OB ultrasound is a huge area of interest for a lot of people. We get to do growth scans, anatomy scans, umbilical artery Doppler. And that is really unique training for family medicine. And so getting to have that diverse skill set by the time we graduate is really awesome.